Hello, I'm Sean Sang-won Park, prosthetic urologist practicing in Seoul, South Korea. Recently, I was invited to the ICSM meeting. So this ICSM meeting is held generally in interim of 5 years, but due to the COVID, it's been 9 years since the last meeting. The goal of this meeting is to create the guidelines for our general practice. And it can also make a guidelines of various parts of the sexual medicine. So we had 23 or 4 committees, and each committee has around 10 people. It's a huge number of people gathering around in one place and working on the guideline. Guideline is a kind of rule book for us, for doctors. So let's say if we prescribe some medicine or order some testings, we need to do it according to the guidelines. That's how I was trained during my residency. I was curious about how it was made. So luckily I was able to see how it goes. And as expected, it was a very grueling and rigorous job. To make one sentence of the guideline, we had to work out quite at least 3 or 4 or 5, 6 study publications and go through it and check it out that whether it is scientifically right or wrong. At the same time, that should not hinder the surgeons or doctors' practice by limiting their, activities. You can think it like a guideline is not just a strict line, but give us some space so that we can work things on within those boundaries. It was a great joy to watch it. Actually, before we present our guidelines, we gathered around at the pre-meeting and simulated something like a war game. What if somebody accuses you with that? Do you have a reference for that? Or why do you think that? Shouldn't this be included or not? Something like that happens. What are you going to do? So we had to work on all those scenarios so that we won't be attacked at the presentation. My part was a penile implant, surgical approaches, and luckily it was not really attacked. All thanks to the Dr. Kohler and Dr. Wong and the other members. Overall, joining the meeting was a great joy. I was able to understand that a guideline is something that we created out of the publications we have, references we have. Guideline is created every, I believe, around 5 years. So 5 years interim, there's a lot of publications are coming out. I should update myself with the new publications and new studies so that I can keep my patients best possible care. Actually, it gave me, enlightenment that, this is the reason why attending conferences and keep updating myself is important.